All right, so got this about 2 days ago. It was just slightly red, and then the next day it was just a little swollen, a little more red, and then as far as the third day, really swollen, as you can see, more red. So it's pretty much confirmed, kind of like it's a stye. There's no vision changes, no nothing, just a little tender to touch. Doing the warm compresses, Advil, just for inflammation. Took a Zyrtex just to help out too, but really nothing. So then they just do a telehealth appointment, and then what I did was just got erythromycin ointment just to help out. I have to apply it 4 times a day, as you can see. It's still red, so let me apply it right now. After 2 applications, it looks a little better, a little swollen, a little better. Still a little redness here, so it's kind of working. So it's about day 3 with this stye. It looks a little better, less swollen, still a little red here, as you can see. I've been using more of this one, the steroid lid, to help clean off, and then doing the warm compresses, and then placing the antibiotic under. Let me see if I can get a video of placing the antibiotic. So erythromycin. Take this, pull the eyelid all the way down, as you can see, and then kind of just gently touch that in there. Let it just glide in, and then it should go. You see it in there? And just hold the eye closed, about 30 seconds or so. And after that, it's gonna feel a little blurry or anything. You just kind of like blink it. And then the reason you go on the bottom lip is so you can hit the top when you start blinking. So you're not gonna be placing it on the top lip, even though it's up there, but it's from the bottom. It'll like touch on the top and then go inside. And then, yeah. There you go, and then we'll see. I've been doing it about 4 times a day. Let's see how it goes. All right, day 4 of the stye. I don't know if it's even the stye anymore. It feels like blepharitis, or it could be calazone, but it doesn't feel as tender or anything to touch or anything like that. It looks okay, just kind of like a little wrinkly. I felt a little more drainage overnight. I've been doing a lot of warm compresses, using this dry eye mask warm compress, and that kind of helps moisten and help warm it up. So just applying the erythromycin still. So we'll see how it goes. If you look at it, it's more just red. My eye kind of gets irritated, so I kind of put like the Visine to help out. But the swelling has kind of died down, but it swells up in the morning, but then kind of goes away. But it was draining a little fluid overnight, which is kind of, I think, good news. But we'll see if it helps clear up and stuff over time. So we'll keep continuing the warm compress and erythromycin. All right, day 5. As you can see, it's gotten a little less swelling, wrinkly. So I think that day it was draining yesterday kind of started working. Been doing these warm compresses, just a little small here, and so placing the erythromycin. So yeah, looking much better. Some more improvement. Kind of looks like almost like the first day. So hopefully it starts clearing up a little more. But continue with the warm compress and the erythromycin and see how it goes. So yeah. So day 6 of this stye looks like it's turning more into balls. It might be chalazone, whatever it is, but yeah, still doing the warm compress. Looks less swollen a little bit. Redness has decreased on this side, you can tell, just a little bit still here. So yeah, still doing the warm compresses, the erythromycin. I think the warm compresses are helping more. Erythromycin is just protecting for any infection risk, but the erythromycin kind of gets irritated in the eye, so I've decreased it down from 4 times a day to twice a day now. So we'll see how it goes. It's getting at least a little better than before. Yeah, there you go. All right, another update. As you can see, it's dried up a little bit more. Now there's this little pus that's showing up here. I'm just gonna continue warm compress. Hopefully it just breaks and drains itself. Continue the erythromycin. So yeah, much better. Came a long way. It's heading in the right direction. Just have to worry about this staying clean. And we'll just continue on. Not a pretty sight, but hey, it is what it is. All right. It's another update. So yesterday there's that little white pus that was there. I did the warm compress and ended up popping right away and started draining a little bit. Didn't irritate or push it out. So looks a lot better. Less swelling up here, less redness. Just dryness of the skin, just healing properly. That's my eye. I can open it more. Just put the erythromycin ointment in there right now to continue to keep it clean. Might do it for one more day because it's a 7-day treatment. And then we'll see how it goes, but continue the warm compress so it heals and drains everything else out. Yep. So update, looks like just yesterday the pus popped. A little more has came back, but it's looking much better. Redness has decreased, swelling has decreased. So it's just a little formation. It's gonna continue warm compress, last day of the erythromycin, and see how it goes from there. So yeah, not bad. Let that just simmer down, but you see all that. So you don't want to squeeze it or pop it and then reinfect the eye. So let it just heal naturally. I know it doesn't look nice, but better for it to go away than come back. All right, after 7 days of erythromycin ointment and more compresses, this is how it looks. It looks a lot better. It's a little dryness here and a little pus that's still there, but it's improved a lot. Not as much swelling as before. Redness has decreased. That's just that little spot that's right there. So yeah, good improvement. I guess it does take 1 to 2 weeks. You just have to continue at it and just hope it doesn't get reinfected for one reason or another. And there you have it. All right, update. Past couple days has been more dry. It's a little pus, but it's really dry, nothing draining. Didn't do the warm compress for the past 2 days or so. So it's been almost about, I think, a week and a half or so. And this is how it looks. Swelling's all gone, redness, everything. So it's just that little section that's just like irritating and lingering on from there. So it's gonna continue warm compress today and see how it goes in the next couple of days or so. But here we go. As you can see, after a couple weeks, about 2-3 weeks, it got really better. Everything pretty much cleared up. Just kind of left like a small little redness scar, but it's not noticeable or anything. It got really good, but yeah, it was crazy like how it looked and stuff. But I still continue using the same treatment of like the warm compress, keeping everything clean, dry, and just it's preventing eye dryness, because usually eye dryness can be the cause of it. So yeah, that's all I did, and luckily everything turned out well. So keep at it. Eye hygiene is very important, and especially if you have kids around, be careful. And these are the products I just used. Was a Sterilid eye cleanser, the erythromycin. We use this ointment. Pretty much helped out, but kind of started burning after a while. The Sterilid you clean from the inner outer with a dry cotton swab, and this is just a good routine maintenance even without an infection. And the dry eye mask. This is really nice to help moisturize the eyes. You can also do it for a cold compress too. And then these refresh tears, better than Visine, doesn't dry as much. This actually helps hydrate and lubricate the eyes. So this is helping out too. So this kind of became like a daily regimen and routine to help with dry eyes to not get more infections.